Davis. I'm a psychiatrist at the University of North Texas Health Science Center in the geriatric department. I work with Dr. Ross and Barb Hardy and everybody on the team. So basically, today we're talking about burnout prevention in healthcare workers, which is a big topic right now with what we're seeing in healthcare in general, but more specifically with nursing staff and CNAs. So it's something that I believe is probably affecting everyone here today. So we'll go ahead and get started with the presentation. I don't have any disclosures to give for this presentation. And then we'll move to objectives. The objectives basically are just to identify some of the causes of stress and what we call burnout, and then some of the triggers that may promote this kind of stress, and then review some strategies to mitigate the stress and manage some common workplace stressors, and then also encouraging resilience among the staff. So we'll go ahead and go on to the next slide. So first, let's talk about what stress is. And our body has many different responses to stress. As you can see from the depiction, there's different areas of our brain, and each area has a specific response to stress, which may be somewhat different in different people depending on what kind of stress they've encountered in the past. So especially people who have had trauma in the past have a higher sensitivity to different stressors, and maybe one particular stressor or maybe any kind of stress whatsoever. But we do know that long-term stress, so chronic stress, can lead to what we call burnout. And basically burnout is your body's response saying, hey, I cannot do this anymore. I'm shutting down. And again, everybody's kind of threshold level is different. So our job is to help people figure out what are the stressors that might trigger the feelings of feeling out of control, feeling overwhelmed, and lead to these body responses. So next slide. So when we're looking at stress, there are ways to measure it. One of the ways that we measure it is called the Maslach's Burnout Inventory, and they have a specific inventory available for people in the healthcare profession. So they look at different areas of stress. One of the first areas called emotional exhaustion, which measures how overextended you feel in your work environment or how drained you feel. A lot of times people who feel overextended feel like they're not able to meet both their work and home demands. And then depersonalization measures the feeling of not being kind of connected to your environment. So in a patient care scenario, this might feel like the person is not necessarily a person, but a number or a case or, maybe a disease process. They're not looking at the person as an actual person. And then the third area that we look at is called personal accomplishment, which measures how confident you feel in accomplishing your work. On the flip side of that are people who doubt their meaning or the quality of their work, or they feel that they're constantly going to make a mistake or have a consequence to how they perform their jobs. So staff who actually perceive the care that they give as more of a person-centered care tend to have higher levels of personal accomplishment. And staff that have higher levels of personal accomplishment tend to focus more on the empathy and the respect for the people that they care for, especially those with more disabilities. So again, specifically nursing care aides place a lot of value and importance on the work they do because they have, they're very connected to their patients, but at the same time, they also tend to develop more of a cynical attitude because of the high levels of emotional exhaustion that they are dealing with in their environment. So we know that the longer the staff work at a nursing home, the lower the level of satisfaction and accomplishment that they have on their work. At the same time, we also know that especially nursing staff that have been there longer tend to know how to manage their own emotional exhaustion better. So, for example, patients that are not patients, nursing staff that are younger tend to have higher burnout rates. That looking at ages, less than 29 years of age, the burnout rate is about 80%. For nurses, it's specifically, burnout rates are about 83%. And those that are unmarried have higher burnout rates at 85% compared to married. And those with less working experience, less than 5 years working experience, have a burnout rate of about 82%. So those are pretty high numbers, and obviously we want to try to mitigate those burnout from staff, and we're seeing that a lot now, especially during COVID, I think, for reasons that we'll go into a little bit more. I also think that nursing staff have higher mental challenges among the medical professionals just because they are probably the closest to the patients and their families. So they tend to have to feel a lot of pressure from all sides. They're looking at, pressure from the families, pressure from admin, pressure from all different areas of their work. Okay, moving on to the next slide. So we talked a little bit about what some of the sources of burnout are, but more specifically, if you look at the occupational setting that someone is in, staff who are in more violent situations or fear violence tend to have higher burnout. Staff that feel like they are bullied or sexually harassed also tend to have higher burnout rates. And then there's a concept called emotional dissonance, which is the difference between their true emotions and those required to be displayed at work. And this is also noted to be a high rate of burnout. And now I'm going to talk about this a little bit more because I think it's important, especially now, when we talk about emotional dissonance in our current environment. We have so many different conflicts. You're trying to be the best person that you can be, but sometimes insurance companies require certain levels of tasks to be required, and then the admin puts extra pressure on what kind of tasks are required, and all these tasks are really conflicting with each other, and sometimes conflicting with what you think is best for the patient. So a lot of times, as healthcare workers, we have to put our own emotions aside, and even when we don't want to, we still have to do that to help the patient. And this can provide a sense of, maybe I'm not doing the best work that I can do. In addition, for occupational setting, we look at resources. Sometimes resources aren't as much as we would like. Sometimes there's short staffing, there's not equipment for various reasons. We have to make do. So that can sometimes also provide burnout. Then there's this increasing culture of blame. Everybody wants to find out who was the person who did this or did that. And sometimes that culture of blame can be a source of burnout. Then there's high work demands. We kind of talked about, having more patient volume, or, there's always pressure to do as much as you can with the staff that you have. But then there's also, people being out because of COVID, or people, going sick for whatever reason it is. So the work demands have definitely increased. Then we have poorly defined roles and role conflicts. This again goes to, maybe having to take on extra roles because of people who are out, or maybe not having enough staff. There's the feeling of having a lot of responsibility without necessarily having a lot of authority. So sometimes staff may feel like, well, I have to do all this, but I can't make decisions. I still have to, find the person that is authorized to make these decisions. And so it's, again, kind of that internal conflict of not feeling like they can really do the best job. There's the next level is the inability to affect systemic change. I think this is actually a really big issue in healthcare in general right now, because the system is not always beneficial to taking care of patients. And so, we're kind of tied to a system that's broken. And I don't know if anybody's heard of this idea of moral injury. Has anybody heard of this before? But it's kind of this concept of, well, when you think of burnout, you think of, well, a person is really stressed, they can't handle a situation. When we think of moral injury, we think more of the system is broken, and each individual person in that system can't really fix the problem, so they feel inept, basically, and that's where they feel like they can't really make the changes that they need to make. And I feel like, honestly, this is one big reason why we see a lot of people leaving healthcare right now, is because the system is very difficult to manage. And then finally, there's staff perceptions. There's, sometimes staff don't understand the disease process, or maybe there's a lack of communication between the levels of care that a specific patient needs. So there's also, with Alzheimer's and dementias in general, sometimes there's a perception that, they're not going to get better, we're not going to be able to help these people. And so there's kind of like this emotional exhaustion affecting their ability to really help and take care of the patients. All right, next. So the consequences are pretty high for burnout. Obviously, the biggest consequence, and the one that we want to stop, is healthcare workers leaving, and then you have high turnover rates. So we want to try to keep the staff that we have and keep them happy. Other consequences include depression, anxiety, substance abuse, or other health issues. The more burnout they are, the less their immune systems are able to fight infections. So they end up getting sick more and having more issues there. And then there's also the lower quality of care that we see associated with not being satisfied with their job. So, and then finally, there is staff, sometimes damage to relationships, and not necessarily always in the work environment, but it can also be at home. They come home, they're tired, they're irritable, they end up having more issues at home with their family. So all of these consequences can be pretty severe. A lot of times, a multimodal approach to healthcare can help these staff get to where they can see, I'm not the only one who's having to do these things, and they feel, more of that team approach, which helps. So we're going to go on to the next slide and talk about some ways to help burnout. Over and over again, we've found that training helps staff. And so this is one of the biggest things that can help with higher level of, or lower, actually, that should be lower levels of emotional exhaustion. So low education is associated with higher emotional exhaustion. So there's also increased job satisfaction. There's increased attitude or improved attitudes with people who are trained. They feel like their performance is better, their confidence level is better, so they end up doing much better in their jobs. Also, a connected community, which helps them grow and integrate all the information together, is very important. We know that when people feel like they're heard and they're seen and they're appreciated, they feel like their work is important and they matter to the job, then they're more likely to feel less burnout. So one of the things, when they do Gallup polls, they look at how loyal a employee is to their organization. They found in these Gallup polls that the best employers are the ones that cultivate relationships between their employees. So not necessarily between the employer and then the employee, but between the different the coworkers. So the more established relationships, the more friendships they have at work, the better they are at helping each other and working as a team and enjoying their jobs. So more friendships at work means better connections, and they feel better, they do better. There's also greater trust between the co-workers when they have a strong connection, which is important. Because the trust helps them during times of stress and challenge. They can lean on each other. They can feel like they're part of a group and make changes together. They can integrate and, find ways of managing their stress in a positive way. Let's see, exercise is super important. Sleep, obviously, is very important. But going back to sleep and depression and anxiety, I think that, when they are having trouble with depression and anxiety, their sleep is probably not the best. So other ways of managing stress and coping with stress are building resilience. And this is their ability to bounce back to certain situations that may, bring them down, or, say there's a incident that happens. Well, how can we get through this incident in a positive way? What can we learn from it? And we'll talk about resilience a little bit more in the next slide. Then there's peer support programs, for different areas. How can we assist our peers in what they're going through? Say it's day to day, or it could be maybe every 6 months or so, just to kind of get together and find out what can we do to help each other. Then there's mindfulness techniques, which are basically just ways to help with the brain chatter that's going on. How do we get those chatter down? How do we help center our body and think more clearly about situations without feeling so anxious all the time? And then finally, there's the grief management and support, which when I was looking into, nursing homes specifically, there were several studies that showed that a failure to acknowledge that there was that specific staff may be having grief, especially when a patient dies, or that those specific nursing homes had more problems moving through the grief process, and that was affecting satisfaction of the employees as well. So, I think at some level, this kind of goes to the depersonalization, where, you start to think of patients more as a number, or as not necessarily as maybe more as a disease process. Sometimes we also kind of detach from the actual grief that's happening, and for especially newer staff, this may be more difficult for them to handle. All right, next slide. So we're talking about resilient people. There's one, this lady, or Dr. Lucy Hone, she actually did a TED Talk that I really liked, and she talked about some of the qualities that help with resilience. So one thing is that resilient people know that suffering is a part of the human experience. They accept this, they handle that suffering in a way that people who aren't resilient aren't able to really understand. And again, I think with the older population of individuals, this is more accepted. With some of the younger population, they may not exactly understand that suffering is inherent in the human experience. So helping them understand that, this is normal, suffering, loss, all these things that can happen are a normal thing. Or even that maybe it may not be necessarily suffering from their job, but it could be suffering in their life, just day-to-day activities. That life is hard. A lot of people don't really understand that. So the more understanding they have, the more accepting, the better they do with resiliency. A second characteristic is that resilient people tend to really select where they devote their attention. So they look at situations as, can I change this or can I not change this? And is there really something that I can do to affect what's going on? If they can't, they look to things that they can do, usually within themselves. So they have more of a, what we call internal locus of control. They can look at themselves and say, you know what, this is something that I can do to help. If I can't help the situation, I'm not going to get angry or blame or, get upset about it. I'm just going to try to do what I can to help. And then the third thing is resilient people ask themselves, is what I'm doing helping or harming me? So again, looking at how am I handling this? Is this harming me? Am I really helping myself by A, being angry, B, blaming, or whatever that emotion is? Or am I helping myself by having these emotions? And that can go back to any emotion. It could be grief. It could be, dealing with this difficult patient. It could be not knowing how to deal with a difficult coworker. So what are some things that I can do to help myself in this situation? All right, next slide. So I'll talk a little bit about mindfulness, not too much, but mindfulness is a process of, again, intentionally paying attention to each moment with curiosity, openness, and acceptance without judgment. And people who practice mindfulness daily tend to achieve a greater attitude of acceptance and clarity and patience. sometimes loving kindness, you know, so there are specific meditations that you can do to work on loving kindness and unconditional kindness, which I think is very important in the healthcare profession. But there are other types of meditations that people can do. But in all, I think that they allow for you to center what's important in your mind and lower your stress level by focusing on your body, whether it's breathing, you know, whether it's relaxation techniques, whether it's imagery, all these different ways of kind of maybe manipulating your thoughts in a way that's more positive. And these can also work in the workplace environment. There are specific meditations out there for healthcare workers. So it's kind of nice to look through those. There are also different meditation apps available, and some of them give discounts to healthcare workers because they realize that the healthcare profession is a very stressful environment. So lots of different places to do this. One common kind of concern that people bring up to me when they talk about doing meditation is like, some people say, well, I can't really focus on anything for more than a few seconds. And really, meditation only takes about 10 minutes of time a day. I try to help people learn that, you know, it can be 10 minutes, it can be 20 minutes. But if you start out 10 minutes a day and kind of work your way through it, it can really help slow things down in your brain.